When the trauma alarm screamed through St. Michael's Hospital, Dr. David Chun had 4 minutes to save a life. But the mysterious patient in bed 7 was about to teach him surgery techniques that weren't in any medical textbook. Techniques that could only come from the world's most dangerous battlefields. Before we dive into this incredible story of hidden expertise and life-saving moments, I need your help. If you believe stories like this deserve to be heard, hit that subscribe button and give this video a like. Your support helps us bring you more amazing tales of courage and unexpected heroes. And trust me, you'll want to see how this story ends. Dr. David Chun adjusted his stethoscope and glanced at the clock on the wall of St. Michael's emergency room. 11:47 p.m. The night was still young, and in a level 1 trauma center in downtown Chicago, that meant anything could happen. At 28 years old, David was one of the youngest attending physicians in the hospital's history. Fresh out of his emergency medicine residency at Johns Hopkins, he'd been recruited specifically for his steady hands and quick thinking under pressure. But tonight felt different. Tonight carried the weight of impending chaos. The ER was unusually quiet for a Friday night. A few routine cases sat in the waiting room. A college student with a possible concussion from a fraternity party gone wrong, an elderly woman with chest pains that turned out to be heartburn, and a construction worker with a deep laceration that needed stitches. Standard fare for the night shift. David made his rounds, checking on each patient with the methodical precision that had earned him recognition during his residency. His attending physicians had always praised his attention to detail, his ability to spot the subtle signs that other doctors might miss. But experience was something you couldn't learn from textbooks, and David knew he still had years of learning ahead of him. If this story of redemption, hidden expertise, and second chances moved you, let us know in the comments below. Have you ever encountered someone whose true abilities were hidden beneath the surface? Share your story with us. Don't forget to subscribe for more incredible tales of courage, healing, and unexpected heroism. Hit that notification bell so you never miss a story that might just change how you see the world around you. The automatic doors of the ER suddenly burst open, and a paramedic team rushed in with a patient on a gurney. David could hear the urgent radio chatter before they even reached the trauma bay. 26-year-old male, motorcycle versus semi-truck, massive blood loss, possible internal injuries, vitals are dropping fast, called out Sarah Martinez, the lead paramedic. She'd worked with David on dozens of cases, and her usual calm demeanor was replaced by barely controlled urgency. David's training kicked in immediately. He began barking orders to the trauma team as they transferred the patient to the examination table. Get me 2 large bore IVs, type and cross for 6 units, and call surgery now. As the team worked frantically to stabilize the patient, David noticed an elderly man sitting quietly in the corner of the trauma bay. He appeared to be in his 70s, with silver hair and weathered hands. His clothes were simple but clean, and he watched the proceedings with an intensity that seemed out of place for a routine observer. "Sir, you can't be in here," David called out between orders to his team. "This is a restricted area." The old man didn't move. Instead, he spoke in a calm, measured voice that somehow cut through the chaos. "Doctor, your patient is bleeding internally. The abdominal distension suggests a ruptured spleen, but look at his left shoulder pain and the way he's guarding his chest. You're dealing with multiple trauma sites." David paused mid-instruction. Everything the old man had just said was medically accurate, but how could a civilian observer make such precise diagnoses? "I'm sorry, who are you?" David asked, his attention split between the mysterious observer and his critical patient. "Someone who's seen this injury pattern before," the man replied simply. The patient's blood pressure dropped to 80/40, and the heart monitor began showing dangerous arrhythmias. David's team worked with practiced efficiency, but he could see the concern in their eyes. This case was rapidly becoming critical. "We need to get him to surgery now," David announced, preparing to call the operating room. "Wait," the old man said, standing up from his chair. "Dr. Chun, may I make a suggestion?" David was stunned. How did this stranger know his name? "Before you rush him upstairs, check his pupils again. Not just for response, but for the subtle asymmetry. And listen to his lung sounds one more time, specifically the lower left lobe." Against his better judgment, David followed the man's advice. The patient's left pupil was indeed slightly larger than the right, and when he listened to the lung sounds, there was a faint wheeze in exactly the location the old man had indicated. "Tension pneumothorax," David whispered, the diagnosis hitting him like a revelation. He needs immediate decompression. The old man nodded approvingly. The chest injury is more critical than the abdominal bleeding right now. Address the pneumothorax first, then worry about the spleen. David quickly inserted a chest tube, and the patient's oxygen saturation immediately improved. The cardiac rhythm stabilized, and his blood pressure began to climb back toward normal ranges. How did you know? David asked, looking at the mysterious man with newfound respect. Experience, came the simple reply. David worked to stabilize the patient for transport to surgery. He couldn't shake the feeling that this encounter was far from over. The old man's knowledge was too precise, too immediate. This wasn't the casual medical understanding of someone who'd read a few articles online. This was the expertise of someone who'd spent years making life and death decisions under the most extreme circumstances. After successfully handing off the motorcycle accident victim to the surgical team, David found himself back in the trauma bay, but the mysterious old man had disappeared. He asked the nurses and other staff, but no one seemed to remember seeing him leave. "Dr. Chun," called out Rebecca, the charge nurse. "We've got another patient coming in. Elderly male, found unconscious in Grant Park, possible hypothermia and malnutrition." When the paramedics wheeled in their newest patient, David's breath caught in his throat. It was the same man who had provided the impossible diagnostic insights just an hour earlier. Now, lying unconscious on the gurney, the man looked fragile and vulnerable. His clothes were worn and dirty, suggesting he'd been living rough for some time. David began his examination with a mixture of professional duty and personal curiosity. The man's vital signs were stable but weak. He showed signs of chronic malnutrition and exposure to the elements, but there were other details that didn't fit the profile of a typical homeless patient. His hands, despite being dirty, showed no signs of long-term manual labor. His teeth, though yellowed, were in remarkably good condition for someone living on the streets. And most intriguingly, David noticed several old surgical scars on the man's arms and torso, all of which appeared to have been performed with exceptional skill. David cleaned and examined one of the scars on the man's forearm. He noticed something that made him freeze. Tattooed in small, faded letters just above the old incision were the words, "Captain James Morrison, MD, U.S. Army Medical Corps." David's hands trembled as he processed this information. A military doctor. That would explain the diagnostic abilities, the calm under pressure, the precise medical knowledge. But it raised even more questions. How does a trained Army physician end up unconscious in a Chicago park? Dr. Morrison regained consciousness slowly, his eyes focusing gradually on the bright lights of the emergency room. When he saw David standing beside his bed, a look of recognition crossed his weathered features. "The motorcycle victim," he said, his voice hoarse but clear. "Did he make it to surgery?" David nodded. "Thanks to your help. The surgeons were able to repair his spleen and address the chest trauma. He's expected to make a full recovery." Morrison attempted to sit up, but David gently pressed him back down. "Easy there, Captain. You need rest and fluids." The title seemed to surprise Morrison. He glanced down at his exposed forearm and saw that David had discovered his tattoo. "I prefer just James," he said quietly. David pulled up a chair beside the bed. "James, I need to ask you some questions. Not as a doctor treating a patient, but as someone who's trying to understand what happened tonight." Morrison studied David's face for a long moment before nodding. "I suppose I owe you that much. Are you really a doctor?" Morrison corrected. "I was a trauma surgeon with the Army Medical Corps for 15 years. 3 tours in Iraq, 2 in Afghanistan. I've performed surgery in field hospitals, in bombed-out buildings, in the back of moving helicopters. I've saved lives under conditions that would terrify most civilian doctors." David leaned forward. "What happened? How did you end up homeless?" Morrison's laugh was bitter. "Post-traumatic stress, depression, survivor's guilt. Take your pick. I came back from my last deployment and couldn't handle civilian medicine anymore. Every patient reminded me of soldiers I couldn't save. Every emergency brought back memories of attacks I couldn't prevent." The room fell silent except for the steady beep of the heart monitor. "I tried to go back to work," Morrison continued. "Took a position at a VA hospital. But the nightmares, the flashbacks, the constant feeling that I was failing everyone around me, it became unbearable. So I walked away from everything. My practice, my house, my family." David felt a deep sadness for this man who had clearly sacrificed so much in service to his country and his profession. "How long have you been living on the streets?" 3 years, 2 months, 16 days. Morrison replied without hesitation. But I never stopped being a doctor, David. When I see someone in medical distress, I can't help myself. I have to act. Over the next several hours, as Morrison received 4 fluids and recovered his strength, he and David talked about medicine in ways that David had never experienced. Morrison's knowledge was encyclopedic, but more than that, it was practical and hard-earned. The thing about trauma surgery, Morrison explained, is that you have to make decisions with incomplete information. In a field hospital, you don't always have time for CT scans and comprehensive labs. You have to trust your hands, your eyes, your experience. David was fascinated. How do you develop that kind of intuition? By making mistakes, Morrison said bluntly. I've lost patients because I was too careful, too slow, too dependent on technology. And I've saved patients because I was willing to trust my instincts and act quickly. As the conversation continued, David began to realize that he was receiving a masterclass in emergency medicine from someone who had practiced under the most extreme conditions imaginable. The motorcycle victim tonight, David said. How did you know about the pneumothorax? Morrison smiled. The way he was breathing, the position of his body, the subtle color changes in his skin. I've seen that exact presentation dozens of times in combat zones. Blast injuries create similar patterns of trauma. But in a civilian ER, we follow protocols, differential diagnoses. And those protocols are important, Morrison interrupted. But sometimes you have to go with your gut. Sometimes the textbook answer isn't fast enough. As dawn approached, David faced a difficult decision. Morrison was medically stable and could be discharged. But where would he go? Back to the streets? Back to the cycle of homelessness and despair that had consumed the last 3 years of his life. James, David said carefully, what if I told you there might be another option? Morrison looked at him suspiciously. What kind of option? St. Michael's has a program for doctors who are struggling with PTSD, addiction, or other personal challenges. It's called the Physician Recovery Program. Participants get counseling, support, and gradually, the opportunity to return to practice under supervision. Morrison shook his head. David, I appreciate what you're trying to do, but I lost my medical license years ago. I can't just walk back into an operating room. The program helps with license reinstatement too, David pressed. James, what happened tonight wasn't coincidence. You saved that young man's life with knowledge and experience that can't be replaced. The medical community needs doctors like you. Morrison was quiet for a long time, staring out the window at the Chicago skyline as it slowly lightened with the approaching sunrise. I don't know if I can handle it, he said finally. The pressure, the responsibility. What if I freeze up? What if I make a mistake? David leaned forward earnestly. James, you didn't freeze tonight. When it mattered most, you stepped up and made the right call. That's not something you lose. That's who you are. Weeks later, David was working another night shift when he saw a familiar figure walk through the doors of St. Michael's emergency room. James Morrison looked different, cleaned up, wearing scrubs, carrying himself with renewed purpose. Dr. Morrison, David said, extending his hand. Welcome back. Morrison gripped David's hand firmly. Just James is still fine. And thank you, David, for everything. Morrison had successfully entered the Physician Recovery Program and was beginning the long process of returning to active medical practice. He would start as an observer, then gradually take on more responsibility as he demonstrated his readiness. There's something I want to show you, Morrison said, pulling out a small, worn photograph. It showed a much younger version of himself in military fatigues, surrounded by a team of medics and nurses. This was taken at a field hospital in Kandahar. We performed over 2,000 surgeries in 18 months. I forgotten how much I loved the work, how much meaning it gave my life. David studied the photograph. What made you remember? You, Morrison said simply. The way you listened that night, the way you saw potential instead of just problems. You reminded me that being a doctor isn't just what I did, it's who I am. 6 months later, Dr. James Morrison had not only regained his medical license, but had been offered a position as a trauma consultant at St. Michael's. His unique combination of military field experience and civilian medical training made him invaluable for the hospital's most challenging cases. David often worked alongside Morrison now, learning techniques and approaches that weren't taught in medical school. The older doctor had become both a colleague and a mentor, sharing hard-earned wisdom about medicine, resilience, and second chances. One evening, as they finished treating a particularly difficult case, a construction worker who had fallen from scaffolding and sustained multiple injuries, Morrison and David debriefed in the hospital's break room. "You know," Morrison said, "6 months ago, I was convinced my medical career was over. I thought I had nothing left to offer, that my best days were behind me." David poured 2 cups of coffee and handed one to Morrison. "What changed your mind?" Morrison smiled, taking a sip of the bitter hospital coffee. "I realized that experience isn't something you lose. Knowledge isn't something that disappears just because you're going through a difficult time. And sometimes, the most important thing you can do is trust that the skills and instincts you've developed over years of practice are still there, waiting for the right moment to emerge." "The motorcycle victim from that night," David said. "He sent a thank you card. He's back at work, completely recovered." Morrison nodded. "One life saved. That's what it's all about, isn't it? All the training, all the experience, all the sleepless nights. They're all worth it for that one moment when you can make the difference between life and death." 2 years later, Dr. James Morrison had become a legend at St. Michael's Hospital. His story had spread throughout the medical community. The homeless veteran who had returned to save lives, the experienced surgeon who had found his way back from the brink of despair. But Morrison himself remained humble about his journey. He continued to work night shifts, continued to teach young doctors like David, and continued to approach each patient with the same dedication and expertise that had defined his military service. During a quiet moment one evening, David asked Morrison if he ever regretted the 3 years he'd spent on the streets. Morrison considered the question carefully. "Those 3 years taught me something important," he said. "They taught me that healing isn't just about medical procedures and surgical techniques. Sometimes, healing happens when one person sees potential in another. Sometimes, it happens when someone offers a second chance." He paused, watching the organized chaos of the emergency room around them. "You gave me that second chance, David. You saw past the homeless man in the corner and recognized the doctor who was still there, still fighting to help people." David smiled. "You did the hard work of coming back." "We both did," Morrison replied. "That's what medicine is really about. People helping people, doctors learning from doctors, experience passed down from one generation to the next." As they prepared for another long night of saving lives, both men understood that their encounter had changed them both. David had learned that wisdom could come from the most unexpected places, and Morrison had rediscovered that his years of experience still had value, still had the power to heal. The emergency room doors opened again, and another ambulance arrived with another patient in need. Dr. David Chun and Dr. James Morrison walked forward together, ready to face whatever challenges the night might bring. Because sometimes, the most extraordinary heroes are hiding in plain sight, waiting for the right moment to step forward and save a life.